253, Dr. Kevin Kavanagh, retired physician, founder and president of a national organization called Health Watch USA. Dr. K, top of the morning.
Top of the morning, Jack.
How are you today?
Doing pretty good. At least we're not in Washington, so it's actually safer in Kentucky.
Yep. Kentucky, you tell me, as far as the latest efforts to transform our approach to the virus, is about average in the USA 30th, and the number of cases. Let's talk about that to begin with this morning.
Yeah, now that's actually 30th in the number of cases, so we are actually above average.
In other words, this is a good thing. This is a positive thing.
Right. This is a positive thing. And of course, Kentucky's rarely to the middle of anything. We're usually last in the bad way. This time we're actually above average in a good way. And so that is, I think, very good and something that we really do need to commend our response. I also think that we shouldn't think that we're out of the woods yet. A lot of the, good predictions of whatever's been done anywhere, you've got to kind of knock on wood because we still have an extremely high rate of infections. And we have a new strain coming on board, which, as you know, could be more infectious. Good news is, if you follow public health advice, we know how to stop its transmission. And if you get a vaccine and consent to getting the vaccine, then we can actually kill the virus dead. So we know how to do both of these things. So we can't be afraid of the virus. What does concern me, though, is our response. Will the United States public join together and fight this virus and do it in a coordinated, united way? And I think that's of paramount importance.
All right, but I love to start off with good news, and that's the good news is we take it. I think sometimes, though, and I think you'll agree with this, when things sort of start looking up, then we get lax.
Well, that's correct. And that's just kind of human nature. That's why you have these waves with the virus. It's not necessarily that the virus decides, oh, gee, we're beat up some, we're going to retreat, and then later on says we're going to come back. No, waves are caused because when things start looking like they're going well, people relax, and then all of a sudden you're into a second or third wave. And so that's problematic. What is also very concerning is that if you relax and the virus spreads wide around the world, it is very, very much able to mutate. And that's what we're seeing. And so it becomes more infectious, and it could also become more deadly. Sometimes some people think if it becomes more deadly, then that cuts down on its infectivity. In other words, the more severe cases are, the less time people are asymptomatic carriers, the less time they can spread the virus if they're hospitalized or if they're at home being isolated. You can identify that more easily. So they think the infectivity will then decrease. Where the virus is right now is kind of a optimal spot for the virus to spread and to cause the most amount of havoc on the population. And if you had to pick two things, and I know this seems counterintuitive, but if you had to pick between infectivity versus lethality, the virus is going to pick infectivity as far as causing the most havoc on a population. Being more lethal actually sometimes can cause less. That's not saying to the individual, but to the entire population. You can get much more deaths doubling the infectivity of the virus than you can get doubling the lethality of the virus, because infectivity grows at an exponential rate. So it's all up to us. We have the tools to stop this thing. We know how to stop its transmission. We know how to kill it in its tracks. It's just getting it done, getting together to do it.
All right. Now, if you folks have a question or comment for Dr. Kavanagh, we welcome those questions and comments at 253-5959. 253-5959 is both our phone line. It's also our auto text service text line. Now, are we going to expect, and of course, the number of people who were involved in that, whatever you want to call it, riot or whatever you want to call it at the Capitol, there were tons of people outside that did not get into the Capitol, but all in all, there's been, I've heard the estimates grossly, from one extreme to the other in terms of how many people there were there. But are we going to see a spike from that gathering, in your opinion?
Well, you very well could. And of course, very much of a concern is that you now have a new strain which is more infectious. And so the advisements that we've given of how to stay safe or stay safer with the original coronavirus may not hold with the new one because we're not sure what causes it to spread more. But anytime you pack people together, they're not wearing masks or in close proximity. Remember, we've talked about the winter weather, how it's cloudy, cold, and dry. That promotes spread of the virus. So being outdoors isn't as safe as what it was in the summer. So all of that can result in spread of the virus. So yes, I think it will spread from that side of things, but also the legislators, they were also then packed together. Some of them were not wearing masks, and that can also result in spread of the virus on that side. So it is very problematic, and at a time when we should be uniting to fight this thing, we appear to be still dividing and fighting among ourselves, and some of it may be caused by the stress of the virus. And I think if you look at some of the reports, and these are being published in the New York Magazine, Washington Post had an op-ed, Daily Mail also had a report on this, that there is more and more concern that this virus may be something that was either manufactured or released by mistake, but it is a more virulent type of a virus than what maybe could be found in nature. And so I know that's kind of conspiracy theories, and conspiracy theories are something I don't like to promote, but nevertheless, it's another reason why we ought to be uniting, not dividing.
All right, let's take a call. This is Donnie. Hey, Donnie, good morning.
Good morning. Morning, doctor. I have a question. Maybe I'm asking this question to the wrong person. When does us old people get to get our shots?
Boy, I don't know. I'm one of the old people, and I'm still hanging around and waiting for it. I wish it would be quite soon.
They can't make up their mind who's when and when's who. You know what I mean?
Well, I know in some states, if you're 65 and older, for example, in Florida and Ohio, I believe are like that, you can get a shot on the second tier. Right now, if you're 65 and to 70, which is kind of my category, you have to wait to the third tier. So, yeah, it's who gets shots. That's all kind of, to me, in a little bit of a cloud over how it was decided and exactly how it's going to be administered. But how they're going to administer them and get them out to the public is of utmost importance. Right now, I don't think as a nation we've done a good job. And a lot of this is out of the control of the state. Believe me, a lot of this is a federal problem.
I see. Okay. Well, at one point in time, I was 1B, like baby. Now then, I seem to be 1C.
What's your?
So
if you don't mind my asking, sir, what's your age?
I'm 83.
Oh, well, you ought to be high on the list.
I have COPD. I'm on oxygen 24 hours a day.
I can't imagine that you're not really, really high on that list.
And I've had a 5-way bypass.
Lord.
And yeah, really. Tell me about it.
I think you should be still 1B, because 1B includes those that are greater than 70 years of age. What we're doing in Kentucky is not unreasonable. It's a pretty good way of administering the shots.
Yeah, and I call my doctor, and I get no answer out of him. He says, we're on the list to get some, so, well, hell, so am I. I'm on the list to get some, too.
Well, I feel your frustration, man. That's not right. I appreciate your call, though. Thank you. Dr. Kevin Kavanagh is my guest. Got a text in the break. Dr. K said, just tuned in, missed today's visit with Dr. K. Will it be on the website later? Answer is yes. And here's another one. Have they figured out if the vaccine, when given, keeps people from spreading the disease?
Well, the answer to that is no. But theoretically, it probably is a danger of having people spread the disease. And the reason is that our current vaccines make a very specific immunological response that's called an IgG antibody. And it's a myriad of different types of antibodies, but they're all IgG as far as classification. Those antibodies are pretty much just in the bloodstream. What you need to block the infection is IgA antibodies in the nose or along the nasal lining. So if you get the virus, you breathe it into your nose and it infects the lining cells of the nose. And from there, it makes more viruses. The viruses then spread into your body. Now, if you have the vaccine, you kill it dead at that point. If you don't have the vaccine, it will then, of course, spread and cause you severe disease. But to stop the virus from infecting the nose, you need to have antibodies in the nasal secretions, and those are a specific type called IgA antibodies. And one research study that reviewed the literature, and this is from the American Academy of Otolaryngology and Head and Neck Surgery Foundation, which, by the way, that was my specialty. This article explained and outlined all this, that they don't expect it to provide that nasal immunity or IgA immunity. Now, once you get the infection, the body knocks it out everywhere, so it may just be a very short period of time that you're infectious. So the answer is maybe not, probably not, but if you are infectious, it may be just for a short period of time. And of course, you don't know if that person is making enough viruses to actually make him infectious. But that is something we worry about this vaccine, and that's another reason why you should be wearing the mask. And of course, you'll be reading articles about how this new South African variant may evade the vaccines. Well, they're using the word may. In order to evade a vaccine, it has to evade a myriad of different antibodies that your body's producing. And so that is something that's very hard for a virus to do and still maintain its ability to attach to the ACE2 type of receptor. So that's a tall order. As far as evading a monoclonal antibody drug, maybe that's easier to do. That's only one specific, very specific type of antibody. So that's kind of the immunology of the vaccines. I do think you've got to be careful as far as spreading the virus if you get the vaccine until the data is in and known.
Let me ask you this. This is from Bill on our Auto Tech Service text line. Wants to know if colloidal silver spray can help lessen COVID-19 infection.
There's no evidence that it does. I think that that is one of the kind of promoted remedies that the people who are promoting it actually got into trouble with, legal trouble with. So I would not go along with that. Remember what happened with hydroxychloroquine? Everything looked really rosy up front, but then 9 randomized controlled trials showed it didn't work. And that's okay to do in the beginning when you're hit with something, you have no idea what's going on it, and you throw everything at it, including the kitchen sink. But right now, we're far past that. We need to really look at remedies that are shown to have helped and make sure that our chances of recovery are the best that they can be.
Jim, good morning. You're on with Dr. Kavanagh.
Yeah, Mr. Kavanaugh, all the mask wearing that we're doing, has that decreased the cases of the flu last year?
Definitely. It just knocked it out. And that was actually to be expected. I wrote an article on that back in August of last year in Infection Control Today, and it was kind of, create a lot of controversy if you're crazy, but the flu is much less infectious than the coronavirus. So when you do steps of wearing masks, social distancing, it may not be 100% effective with the coronavirus, but it should just squash the flu. And that's what we're seeing. And that's one of the benefits of wearing masks. It not only gives you a protection from getting the coronavirus, but it also protects against flu and other types of pathogens. Likewise, washing your hands the same way. We've talked about handling food appropriately. It benefits you in many, many different areas.
Well, one other little question, I just thought of something. The Lysol spray, when you spray it in the air, does that kill the virus in the air?
Well, probably not. That hasn't been studied. Lysol spray is a disinfectant, and it's probably not a good idea spraying it and inhaling it either. It may do as much damage to you as the virus, so I would be careful. If the virus is aerosolized, it will float around for hours and can live for hours, but it only aerosolizes under specific conditions, and that's usually of loud singing, screaming, vocalization, and that's what makes, for example, sports events, bars, so problematic, because they're a setup for that to occur.
All right, listen, thanks, Tim. We got about a minute and a half. Can you just real quickly go over the bills, or at least some of them, that are being fast-tracked in the Kentucky legislature?
Well, the one that is really of concern to me is House Bill 1, where they're trying to change course of how we're addressing the virus. And granted, that may need to get done, but it's hard to change horses in midstream. And that is putting more emphasis on guidance on the CDC, or actually on CDC recommendations as far as opening and closing schools. I think that people need to work together. They need to feel comfortable working together. But as you know, Jack, over the last 9 months, we have discussed problems with CDC guidance. CDC's flip-flopped and reversed on a number of things. This runs from masks to not testing of asymptomatic people, not having clear guidance on schools. And so all of this, I think, means that you maybe need to look at another remedy than having the CDC being totally relied upon, because they were just crushed under the political pressure of the last administration. And frankly, I think Republicans should be more looking at local control and local guidance rather than looking at just the CDC. Now, certainly if you have a national guidance, that's important as far as national coordination, but just looking at an organization that doesn't really make a lot of recommendations, just kind of guidance for this situation or that situation, that's a little bit too tenuous. I think we need a nationalized, coordinated structure with a lot of input from people, everybody on the same page. And that's a tall order to do. And so I think House Bill 1 really needs to be looked at carefully to see if the remedy it's proposing is what's needed for Kentucky. And I have my concerns with it.
Someone texted in support of your comments about the flu, that Fayette County Health Department has reported that the flu has been almost 0 cases. So, yes, you are correct in that because of, I guess, the efforts that we're making with the coronavirus. We are out of time. Always appreciate you being with us this morning. We will look forward to your presentation come Monday. Hope you have a great weekend.
Thank you very much, Jack.
That's Dr. Kevin Kavanagh. Dr. Kavanagh is a retired physician and also the president and founder of Health Watch USA.